So how does the nurse become the champion for the cause and being an advocate for ethical AI in healthcare? As we keep seeing AI in healthcare present a wealth of opportunities, we have to consider the ethical considerations um, that nurses have the responsibility to address. So nurses can become champions for these ethical AI practices and ensuring technology serves patients and not the other way around. So nurses are, as we know, on the forefront of patient care. They witness firsthand the potential benefits and also can identify the pitfalls of these AI being implemented into their practice. So nurses can ensure that patient privacy is protected, informed consent is obtained when it's needed. When AI is being used in their care, they can advocate for clear communication about how AI is being used and actually be able to talk about some of these limitations and how nurses and clinicians are able to overcome these to have a sense of security for these patients and the use of fairness of these models being used. And this can come from nurses just being able to vocalize the dangers of bias in the algorithms and advocate for the fair and representative data collection practices. They can ensure AI doesn't exacerbate any existing health disparities. Um, AI can surely never replace a human touch in patient care. And nurses being able to advocate for responsible AI integration can prioritize that compassion, that empathy, and that irreplaceable nurse patient relationship. And being by actively participating in the discussion of AI development and implementation and becoming AI champions in their own healthcare organizations, they can ensure that these ethical considerations are prioritized. They can be the voice of responsible practice that benefit both the patient and the healthcare professional. So it's pretty not simple, but what we need to do as nurses to become these champions is we need to stay educated and aware. We need to make sure that we're staying informed about how AI is being implemented and educate the peers around us that haven't gotten the bug like we have about potential ethical concerns, but then how these models have the knowledge um, and be able to talk about the biases and the data privacy and the importance of still having humans integrated throughout this process. Um, being leaders to advocate for the ethical AI implementation within your healthcare facility because we have the greatest voice. We can work with administrators if we're not in an administrative role um, to develop the policies that prioritize fairness, transparency, and that patient well-being when we're implementing these AI solutions. And becoming involved in nursing organizations that are advocating for responsible AI use. These organizations can provide support and resources that go beyond what you may be able to just search for on the internet for these nurses who want to be these change makers and these champions for AI and healthcare integration and just having this public discourse, um, being able to share your concerns and your recommendations with policymakers and healthcare stakeholders, having that public awareness and dialogue are crucial for ensuring responsible AI development. And the nurses have a powerful voice in healthcare. And you're here now learning about AI so that you can be some of these champions for this AI integration into healthcare and being able to advocate for ethical AI practices and holding the healthcare system accountable. Nurses can ensure that AI becomes a tool for good, improving patient care while upholding the highest ethical standards is where our voice matters, and the action that we can take can make a significant impact into the future of healthcare.